About 2.1 million Americans are expected to be diagnosed with cancer this year. As an oncologist, I'm very excited to share with you uh, a new technology where scientists have developed a blood test designed to detect signals from multiple cancers at the same time. Right now, we have proven screening strategies for only a handful of cancers. That would be breast, colon, cervical, and lung cancer in appropriate patients. But many cancers have no routine screening tests for the average individual. Pancreatic cancer, a big killer, ovarian cancer, kidney cancer, bladder cancer, leukemia, lymphoma, head and neck cancer, and several others. And this is where the technology could become incredibly important. Every day, as normal cells die from our gut, for instance, they release tiny fragments of DNA into our bloodstream. We call that basically cell free DNA. Cancer cells release DNA as well. The cancer cells' DNA are referred to as circulating tumor DNA or ctDNA, and the scientists can analyze what is circulating in the blood and look for those mutations or what we call DNA methylation patterns and other molecular signals associated with cancer. And some of these methylation patterns may even help us predict where in the body that cancer signal is coming from. It's mind boggling. Yet a blood test detects a molecular signal suggesting that cancer could be present, and that could allow doctors like myself to investigate before symptoms appear and potentially catch things at an earlier stage. Again, we need to be scientifically careful. A positive blood test does not prove that someone has cancer. It tells us that we found a signal that needs further investigation. Depending on where that signal appears to originate, the next step could include targeted imaging, endoscopy, and ultimately a biopsy. And these tests do not replace the cancer screening that we already do to save lives. The biggest question is, can detecting cancer earlier this way actually reduce cancer death? That's really what I care about, and the suffering from it. And that's exactly what large clinical studies are trying to determine today. The National Cancer Institute is already studying a multi cancer detection test in thousands of people with plans for much larger randomized trials. So imagine the potential. Instead of waiting until cancer becomes large enough to cause symptoms and you end up having to see me and get treatment, we may eventually detect its molecular fingerprint circulating in the blood. For the millions of people that are diagnosed with cancer every year, earlier detection could mean finding more cancers when treatment has a greater chance of success. We're not completely there, but if these studies show that this technology actually saves lives, this could become one of the biggest advances in cancer technology and detection in decades. Very excited to share this with you.